Hey everyone! So by request, I am doing a really quick video on the PowerPoint on muscles of the posterior arm and back. So here is just a picture of some of the muscles that you guys will encounter that you need to know for the upcoming lab exam. Of course, we have muscles of the back, including the latissimus dorsi, which we see right here. And then we see muscles that secure and stabilize the shoulder. So we have our sits muscles, which are our muscles of the rotator cuff. So we have the supraspinatus, the infraspinatus, the teres minor, and then anterior to that would be the subscapularis. We also have the teres major right here, again forming that border, the inferior border of that muscle, which separates the axillary artery from the brachial artery in the arm. And then the large muscle posterior to the arm, we see the triceps brachii. As of this slide, we can only see the posterior portion of that muscle, so we see the lateral head located laterally, and then the long head located medially. And underneath would be that third part of the triceps brachii, because again, tri means three, ceps means head, so triceps brachii, it's a three-headed muscle. So here's that picture of Lou Ferrigno. Lou Ferrigno, again, being the original Incredible Hulk. We can definitely appreciate many of his muscles, both anteriorly and posteriorly, because, again, he did work out a lot, and you can see why he was chosen to be the Incredible Hulk. Although here, he is definitely less green. So the first muscle we will go over is the trapezius muscle. The trapezius muscle has its origin in the skull, so the occipital bone of the skull. Also has its origin in the spines of vertebrae C7 through T12. It will then insert into the clavicle, the acromion, as well as the scapular spine, and its action is to elevate the scapula, adduct the scapula, so AD, adding to the midline, so the scapula is going towards the midline, and then rotating the scapula. This is one of the muscles that does help stabilize the scapula. So if you take a look at this slide, it can show you the bony markings that act as the origin and insertion of the trapezius muscle. So in red, we can see the bones that act as the origin for the trapezius. So we have the occipital bone, as well as the spines of C7 through T12. The insertion of the trapezius is seen in blue. So the insertion of the trapezius is the clavicle here, part of the acromion, as well as part of the scapular spine. The next muscle is the deltoid muscle. This is a muscle that's very important, especially in performing injections of immunizations that we do intramuscularly at a 90-degree angle. So the deltoid, the origin of the deltoid is at the clavicle, the acromion, and the scapular spine, basically where the previous muscle, the trapezius muscle, has its insertions. So the deltoid, its insertion is into the deltoid tuberosity, that sort of pointy part of the humerus that is lateral, on the lateral part of the humerus. Its action is to abduct the arm, so bring the arm away from the midline. Its actions also include flexion as well as extension of the arm and medial and lateral rotation of the arm. So here again on the bony skeleton, we can see its origin on the clavicle, the acromion, as well as the scapular spine. And then its insertion into that pointy part of the humerus, the deltoid tuberosity. So here we see it in blue. Next muscle are the lats, the latissimus dorsi muscle. Its origin are the spines of vertebrae T7 to L5, as well as the iliac crest inferiorly. it will insert into the intertubercular sulcus of the humerus. Again, this is that sulcus between the greater and lesser tubercle. Action of the latissimus dorsi is extension of the arm, medial rotation of the arm, as well as adduction of the arm. So bringing the arm away from the arm, bringing the arm towards the midline. So adding towards the midline. And here we see the latissimus dorsi. So here again on the bony skeleton, we can see its origin on the spines of T7 through L5, as well as the iliac crest on the ilium. And then its insertion will be on the intertubercular sulcus, so that sulcus between the greater and lesser tubercle of the humerus. Here's just a picture of some very well-defined lats. I remember working out, we would do lat pull downs, which would kind of build up the muscle in our back. The latissimus dorsi helps with swimming and movement of our arms, so we can swim just a little bit faster. Although I never really wanted to have lats as big as that. The next muscle is teres major. Teres major is this large muscle right here. Again, the inferior portion of that muscle serving as the border where the axillary artery ends and the brachial artery begins. So the origin of the teres major muscle is this inferior angle of the scapula located right here, and its insertion is into the lesser tubercle of the humerus. So if you could see, it's actually hidden behind these muscles, but it will insert into the lesser tubercle of the humerus. Its action includes extension of the arm, medial rotation, adduction, so bringing the humerus towards the midline. Also acts as a synergist, or kind of adding to, or helping with the action of the latissimus dorsi. So here we see on the bony skeleton, the origin is the inferior angle of the scapula, and then its insertion is into the lesser tubercle of the humerus. The next muscle is the triceps brachii muscle. So here we see this large posterior muscle in the back of the arm. The origin of the triceps brachii muscle is the infraglenoid tubercle, as well as part of the posterior humerus, so we can't really see it behind or deep to these muscles. But again, that infraglenoid tubercle, basically that little tubercle that is inferior to the glenoid cavity. Its insertion, the triceps brachii insertion, is in the olecranon of the ulna. The main action of the triceps brachii is to extend the forearm. Then we have our rhomboids. So first we have this large muscle, which is the rhomboid major muscle here. Its origin are the spines of T2 to T5, and it will insert into the medial border of the scapula, and its main action is adduction, or to adduct the scapula, bring the scapula towards the midline. So this is one of the muscles that helps stabilize the scapula. Here we can see on the bony skeleton origins of rhomboid major T2 to T5, and then its insertion into the medial border of the scapula. Rhomboid minor, origin of rhomboid minor includes the spines of C7 and T1. It will insert also into the medial border of the scapula and also helps with adduction of the scapula, again helping to stabilize the scapula. And the levator scapulae muscle. So levator scapulae has its origin in the transverse processes of vertebrae C1 to C4. It will insert into the medial border of the scapula, specifically the superior medial border of the scapula. And like its name implies, it helps elevate the scapula, also helps with adduction of the scapula, just like the rhomboids. And then we go into our rotator cuff muscles. So the first muscle that we're going to talk about is supraspinatus. So the mnemonic that I like to use for the rotator cuff muscles is sits, S-I-T-S. So the first S in sits is supraspinatus muscle. So supraspinatus, as its name implies, is a muscle that is located above or superior to the spine of the scapula. So the origin of the supraspinatus muscle is that supraspinous fossa. It will then have its insertion into the greater tubercle of the humerus. Now its action is to abduct the humerus, so bring the humerus away from the midline, and this is again is one of the rotator cuff muscles that will help stabilize that shoulder joint. The next rotator cuff muscle, the I in sits, is infraspinatus. Again, as its name implies, it is inferior to the spine of the scapula. The origin of the infraspinatus is the infraspinous fossa, and again, its insertion will be into that greater tubercle of the humerus. The action of the infraspinatus muscle is to laterally rotate the humerus. And again, it being one of the rotator cuff muscles, it helps stabilize that shoulder joint. The next rotator cuff muscle is teres minor muscle. So teres minor muscle is a little bit smaller compared to the teres major muscle. The teres minor muscle has its origin in the lateral border of the scapula and will also insert into the greater tubercle of the humerus. The action of the teres minor muscle will be to laterally rotate the humerus as well as help stabilize the shoulder joint. The final muscle in our rotator cuff muscles is subscapularis muscle. You can find it anterior to the scapula, so on the anterior surface of the scapula. The origin of the subscapularis muscle is the subscapular fossa. Its insertion will be into the lesser tubercle of the humerus, and the action of the subscapularis muscle is to medially rotate the humerus, and again, also help with stabilizing that shoulder joint. Now, nerves that we can see and that you are responsible for, there's only actually really one nerve that you'll be responsible for the posterior arm, and that is the radial nerve. So the radial nerve is very deep. It's best seen in a posterior view. So if we actually could see a cadaver, normally we'd have the cadaver in the prone position, meaning they would be facing down. And then we can see the posterior arm, and the radial nerve could be seen between the long and lateral head of the triceps brachii muscle. Innervation of the radial nerve. So the radial nerve will innervate, of course, the triceps brachii, the medial and lateral heads. It also innervates the posterior forearm muscles. So these are extensors, as well as the posterior lateral skin of the arm and forearm. So in a cadaver section, we can actually see the radial nerve located here between the lateral head of the triceps brachii as well as the long head of the triceps brachii. So here is that radial nerve. It's actually pretty large. If you could see it in the cadaver, you would be able to appreciate it if the cadaver was in the prone position, meaning facing down, or if we look at the posterior aspect of the arm. Okay, so that is the PowerPoint that I presented this morning. As you can see with this blinking arrow, that's where the radial nerve is. Again, you will need to know the origin, insertion, and action of all the sits muscles. That will be included on your practical exam. And I will include a list of all the other muscles that you will need to know for origin, insertion, and action. Okay, hope you guys enjoyed this PowerPoint. I will be posting this, and if you have any questions, please don't hesitate to send me a message. Okay, thank you.